Newsfirst, Newsline.
Hello there, a very good evening and welcome to another edition of Newsline. Joining us this evening is Dr. Vasan Ratnasingam. He is a General Committee member of the Government Medical Officers Association. A very good evening, Doctor, and welcome to the show.
Good evening, Shalan Benedict.
Yes, Doctor, thank you very much for joining us on our show. Just to start things off, Doctor, Sri Lanka is amidst this entire economic crisis. As a result thereof, Sri Lanka is now facing also a shortage of medicine. However, since there are so many issues that are being discussed on the news these days, the issue of medicine shortages has not really, been spoken of quite much as it was in the past. During the recent few months, at least, there were incidents, isolated incidents that were reported every now and again of, for example, the equipment or the substances needed to test blood being missing. But Doctor, since the whole medicine shortage began, where are we now? Are things better? Are they worse?
I feel that we are getting worse when compared to the situation we had in last March or April. So we are getting worse. So unfortunately, we appointed a committee within the GMOA to study and mitigate the drug shortage throughout the country. And the proposals, which consist of 10 points, were submitted to President, Prime Minister, and Health Minister and other health ministry officials with regard to alleviate the shortage of drugs particularly. But unfortunately, Ministry of Health has not taken necessary measures in order to alleviate or avoid this crisis. So now you see in the shortage of medicines exist from minor hospitals to major hospitals, like, even in district hospitals and central dispensaries and major hospitals like teaching hospitals, national hospitals, all the hospitals, the shortage exists to a great extent. So that doctors, we have a morale to serve the people and to maintain the continuous efficient healthcare delivery. But unfortunately, we are lack of physical resources, which halt us providing the routine duties and responsibilities. So if you come to the situation like, we have been compelled to postpone the routine surgeries and only switch on to the emergency and urgent surgeries. And some of the hospitals, the patients who are receiving medicines or receiving some drugs for their illnesses in clinic setup also been turned up empty-handed, or sometimes they were asked to buy majority of the medicines in outside pharmacies. So if you come across the pricing of medicines also has gone up exorbitantly. You see that, even though the dollar rate has gone up 1.5-fold, but the medicine prices has gone up 3-fold or 4-fold, sometimes 5-fold of the existing prices. So this was the burden given to the people of this country, and where they are unable to seek health assistance from the Health Ministry of Sri Lanka. So this is the unfortunate situations we have come across so far during the medical career or the medical community, which we have faced or compelled to face these situations in a difficult manner. Yeah.
Dr. Vasan, you just mentioned that although the dollar has only increased maybe 1.5 or 2-fold, the prices of medicine have gone up 5-fold. What do you see the reason for this? In your perspective, what is the reason for this?
So basically, there is a pricing mechanism with regard to medicines. And also we had a discussion with the president of this country in order to provide concessions for the commonly used drugs for the patients. So if you come across the disease like diabetes and cardiac illness, respiratory illness, and the basic drugs such as paracetamol, Pyritons, and then normal saline and so on. So that the president shown the green light to reduce or issue the concession for the certain drugs and all. But the health ministry, of course, has to take the responsibility to provide the concessions, is preparing the list of commonly used drugs. But that is not happening from the ministry side, so that we were unable to provide the exact pricing of the medicines. But and also, as you all know, that if you would have practiced the rational drug policy implemented by Professor Senaka Bibile in the past, so that we will be having certain regularized prices for at least the essential drugs which are being commonly used in this country. But the rational drug policy which was implemented, which was proposed by Professor Senaka Bibile, that is not implemented fully, but with the agenda of certain government or some of the individual, it has been implemented partially. But if we implement it the full strength or fully, we'll be able to establish sustainable pricing for these commonly used drugs. In addition to that, as you all know, the drug mafia may be operating within the country or within certain ministries. So probably they will have a greater influence in pricing the medicine within the country.
Dr. Vasan, also there have been certain proposals made on how to offset this entire situation that Sri Lanka is facing right now, and many of these proposals entail that people pay for what they get, be it services, be it medicine, be it products, that people pay their fair share when they obtain these services or products. And then, despite the fact that there is a free health system here in Sri Lanka, one of the proposals that were floated was to allow paid wards inside general hospitals of Sri Lanka that would have conventionally been free of charge. What is the stance of the GMOA on this specific proposal?
Of course, the paid ward system or the paying wards is already existing in some other hospitals, like Sri Jawaharlal General Hospital and National Hospital of this country, and some of the base hospital also exists at present. So we appreciate the move taken by the government, but they have to very clearly study the situation and make a very clear-cut proposals. Because we have the thought always, the government is trying to abolish the pre-health services and reduce the private or the privatization of health sector under the guise of economic crisis. So that GMOA has always for the citizens of this country, and we stood for the right to health and right to life of the people. So if the government is making a move under the guise of economic crisis to privatize the health sector, we will not allow. We will definitely or unconditionally will join the protest, or we will defeat this move of the government in order to safeguard the people from the current economic crisis. And ultimately, if the government is on the move to make it as a private, privatization of the health sector, majority of the citizens of the country will be pushed in the language stage to receive that free health. So it is ultimately the burden for the people of this country. So we will not allow that to happen, and we will be calling for the help, and we will be calling for the United Alliance, and we will make a formidable alliance to defeat this movement, definitely.
Dr. Vasan, since you brought up the subject of going on protest and pressing the government to make certain decisions that the GMA as an organization feels should be the case here in Sri Lanka. The GMOA was known in the past, especially when it comes to certain political matters, to take a stand on those political matters and to maybe even go to the distance of engaging in trade union action. But of course, with the economic crisis setting in, the GMOA has arguably been a little bit less active in that field, at least, of opposing matters of a political nature that doesn't specifically affect doctors themselves, as far as the trade union is concerned. Just one example, I believe in the past, when the MCC agreement was bought, the GMOA took a stand, the GMOA went on protest. So has there been a change of heart as far as the GMOA is concerned on these political matters, or is the GMOA now going to stick to matters that affect the medical sector of this country alone? Since you spoke about protests, that's the reason I'm posing you this question.
Exactly. As a spokesman for the Government Medical Services Association, GMOA always was apolitical, so that we never involved in politics. But we always looked after the interest of our memberships. So that fact you must understand. In addition to that, we always we always stood for the people's right, and in order to to fulfill the public's expectation as well. So we were never political, and we always stood for our membership and citizens of this country. So whatever the movement is being brought by the government, which will affect the health sector or the people of this country, we will be in the front line to defeat that move. So never forget the fact we are always with the people, and whatever the consequences we will get to face. So the protest and the demonstrations and all these fight, it's not new for us. From GMO's inception, we are facing the struggles and fight. So that we will be always with the people, and we will be always with our membership in order to achieve our targets. So our main aim is to provide the efficient, continuous healthcare delivery for the citizens of this country, so that the free health services has to be preserved, and it should be maintained as it is. So that is our aspirations and expectation. We will always stand for it.
Thank you very much, Dr. Vasan. Of course, there are many other issues that we need to discuss, especially as far as the brain drain here in Sri Lanka is concerned, as far as doctors migrating overseas and many other professionals migrating overseas as well. Dr. Vasan, we will cross over to a short commercial break and we'll discuss more on the other side. Stay tuned. You're watching Newsline on TV1.
Newsfirst, Newsline.
Welcome back. You're watching Newsline on TV1. We're in discussion with Dr. Vasan Ratnasingam, a General Committee member of the Government Medical Officers Association. Dr. Vasan, at the beginning of the program, we discussed about the medicine shortage in the country, and also regarding certain political stands taken by the GMOA as far as the free health sector in this country goes, and the protection of the free health system in this country. Doctor, besides the crisis in accessing medicine and so on, there is also an issue of brain drain here in Sri Lanka. Sri Lankan currency has depreciated to such a degree. The taxes are sky high. People feel that they are not getting the lifestyle that they deserve, the lifestyle that they worked for. The drop in the living conditions in the country has forced many professionals who can find some sort of employment overseas to move overseas, and among them, chief among them being doctors, engineers, and various other professionals, accountants, so on and so forth. So, Dr. Vasan, since you are from the medical GMOA, how bad do you think the brain drain in the country is, at least as far as doctors are concerned?
Actually, concerns with regard to the brain drain, the government has to take necessary steps in order to retain the doctors, particularly the other professionals, and particularly the doctors within the institutions. Otherwise, it will be difficult to maintain or sustain it. So now, even if you take the past 10 months, nearly about 600 doctors, they have left the country. And out of that, about 60 to 70 doctors, they have left the country without informing the Ministry of Health. So the situation is getting worse in near future. So, and also if you see, the majority of the doctors are preparing to go abroad, say finding jobs, and they are involving with certain exams in overseas, like such as AMC, lab, and so on. And also, if you get the data in order to obtain the good standing certificate, the certificate of good standing, which should be annexed when they apply for the jobs in other countries. So nearly about 2,200 doctors, they have applied during this year. So it means the 600 has already left. Another 1,600 are taking necessary measures or the preparations to leave the country. So that government has to announce certain attractable measures or government has to take or into consideration of looking after the doctor's welfare, with regard to the reduction of taxations and providing concessions in the taxations and introducing new welfare system or the packages for the doctors and increment of their salaries and the wages. So all these to be considered in an adequate manner. Otherwise, the doctors will leave the country. It will become inevitable for the government.
Dr. Vasan, recently speaking, the president was addressing this issue of brain drain. And the president was saying that many of the professionals in this country, they learn through the free education system from grade 1 up until university education. That is a good, say, 15, 16, 17, maybe years of education that people in Sri Lanka pay for the education of various professionals, be it doctors or lawyers or even accountants and engineers who study at government-run universities. He was speaking about how fair it is to allow these people who have learned from the money of the general public to just travel overseas, migrate overseas, taking their skills, all the education that was given to them by the people without serving the country first. It almost appeared as if the president was suggesting a program where all doctors, different other professionals in the country who have learned through the free education system have to mandatorily serve the country for a certain period of time before they can leave the country to travel overseas or seek some employment overseas. As the GMOA, would your organization see such a move favorably, or do you believe that doctors should be given their freedom despite what's happening?
So when you see the statements given by the president or the Minister of Health with regard to the brain drain or doctors leaving the country, the free education is for all. So out of all, doctors are being considered as the cream of the crowd. So they performed their competitive examinations and they become the doctors. So that same opportunity given to all. So we appreciate the move that the government has given grants and allocated the money to produce doctors and professionals in the country. But meanwhile, the professional has to be looked after in the expected amount, say expected to maintain the expected living standard. So if you consider in Sri Lanka at present, the cost of living has gone up. The inflation of this country has gone up nearly 70%. And but whereas the salaries and wages the professional receives remaining the same. Even if you consider the doctors, the debt allowances, disturbance, availability, transport allowance, which was given only 21,000. And now the increases of the prices of fuel, that's petrol or diesel, whatever, it has gone up threefold, which was expecting in right at the beginning of this year. So the government has to provide at least 61 or 63,000 to manage or to manage this fuel cost or the transport cost of the doctors. But whereas government is not doing that. So if you take a case scenario like the doctors who works in Ampara, but whereas family resides in Colombo, he has to travel at least every week. So he has to spend for nearly 25,000-30,000 per time to travel from Ampara to Colombo. So if you consider for about 4 times a week, it would be nearly 100,000 almost. So that whereas doctors are not receiving or not being looked after in that way. So basically, with that, even the doctors and the professionals, they have the morale to serve this country. But whereas with the drug shortage and the shortage of medical equipments and other physical resources has put up there into a say unbearable stress. So with this stress situation, I will expect him to continue to work or to go for an alternative. So it is a question. So that at the moment, each and everyone have a threshold to be in this country or to face the crisis. So if it is beyond the neck, beyond the certain limit, they will have to go for alternative. So if you think the doctors as a person or individual, sometimes their move is correct. But as associations or say the powerful trade union in this country, so we always request the government to make favorable environment for doctors, because though few doctors leave the country, but many have pledged their support or the willingness, they have declared the willingness to stay in this country, serve for these people. So at least this is, not too late. So take necessary measures in order to alleviate the problems or the crisis doctors face. So the government has to negotiate with certain authorities and has to take necessary steps in order to look after the interests of the doctors and thereby retaining them within the country. So otherwise, the health system sooner will collapse or will go into a language stage. Even on the other hand, with the shortage of drugs and physical resources, and on the other hand, with the drain of professionals and doctors.
Dr. Vasan, one final question. Another contentious topic that has come back into the limelight with the debates that are taking place in Parliament right now is this issue of private education, private universities, specifically private medical faculties here in Sri Lanka. Now, we all remember the episode that surrounded Saitam, how it was started by the government under the reign of Mahinda Rajapaksa. Then during the there were massive protests. I believe also certain factions of the medical fraternity were also involved in it. Students were highly against it. The Inter-University Students Federation was against it. There were protests when this was started, when this was brought. During the Yapalne government also, the protests continued, but the regime that brought the campuses initially then turned on them and also joined the protesting faction. And what happened at the end was all of them were taken over by the government. So this time around, again, there are discussions of establishing private medical campuses or faculties. What is the stance of the GMOA on this?
As sure that we are organizations representing all over the country with 133 branch unions all over the island. So that at present, we are getting resolutions from a branch union with regard to non-state medical educations in this country. So we are yet to decide and declare the stance. But unfortunately, the government is taking a move towards establishing the private medical education in this country. But the parliament has declared the minimum standard for the medical education. That is a good thing. But whether the non-state medical education is necessary for this country is a question still. So on behalf of our association, we are getting the opinions from the membership through our branch unions, whether the Sri Lanka country needs non-state medical education or not. So we will declare our stance very soon with regard to that. So that we are yet to decide on our stance with regard to the non-state medical education.
So would this stance be vastly different than the stance that you held with regard to Saitam, or what are the indications like right now?
The Saitam, of course, it was established violating all these norms, so violating all these procedures. So it was a fraudulent institutions which was declared by all the citizens in this country. Ultimately, GMOA won the battle against Saitam. So now the Ministry of Health or the Minister of Health has already declared the minimum standard for the medical education. So based on that, if the government is taking a correct move, GMOA will always facilitate or support, but it should be decided by our memberships. So we are getting opinions from our membership from the bottom level, from each and every branch union scattered all over the country, so that we are yet to decide and declare our stance with regard to that. So that we are currently, our process is underway with regard to the non-state medical education.
Thank you very much, Dr. Vasan Ratnasingam.
Thank you, Shalan. It's a great evening.
For joining us on our program this evening. Thank you very much to all our viewers out there for tuning in. Of course, we will see you again tomorrow, same time, same place. Until then, take care and God bless.
Newsfirst, Newsline.